I first became an advocate for those with rare and undiagnosed diseases in 2012 when I joined the office of Congressman John Cantor and began working on H.R. 1591, the Cal Network Act. The Cal Network Act would create a registry for primary care physicians to use to collaborate and find answers for the men, women, children, service members, and veterans who have unexplained symptoms and medical problems. On average, it takes 7 years for patients with rare and undiagnosed diseases to be diagnosed. Those are 7 years that a patient has to wait for life-saving treatment. It is paramount that we establish the tools needed that physicians need to diagnose patients sooner, tools like the Cal Network Act. I'm so honored to be able to work with Congress and the staff of our DLA towards this goal together.
Rare disease advocates always touch me personally, and that is because I only do healthcare on the Hill, and I'm fortunate to be able to focus on one area only. And I know that they're taking time away, if they're scientists or if they're doctors, for the patients they're treating or trying to treat, if they're family members from their loved ones who are affected, and if they're actual patients, that they're taking the time away from their treatment to come and educate members of Congress who may have never heard about their condition.
For us, we were always in this catch-22 situation where we knew we had strong bipartisan support, but did we have enough support that the legislation would pass on the House floor? And then there was that moment, the 15-minute clock countdown, where you watched the board on the House floor and you watched the numbers tick. And I remember being on the floor expecting the legislation to fail, and then watching the number increase and increase and increase and increase. And it was just a really great moment when you work on policy, that you have that bipartisan support for a piece of legislation and you really see good policy move forward. Really, the thing that I remember most about our first meeting with the Millers, and I think about it still, Ellen said to me, she said to me afterwards, but she said it very clearly to Eric, and it's something that sticks with me. Is this it? Is this all that you all are going to do to help advance research in this space? And Eric, of course, said, no, it's not. And obviously things change with elections, and that's, the beauty of democracy. But hopefully in this situation, the progress that was started with that piece of legislation, it was always meant to be a moving step forward and never the end.
Once you hear one story about a mom who had a child whose newborn had a condition that wasn't caught or could have been treated, it becomes very clear to you why you need to improve screening in all of the states across the country. We have made a lot of really great progress in a short amount of time. So we went from some initial meetings with stakeholders when Senator Hagan took over as chair of the Subcommittee of Children and Families to introduction of the bill just a few short months later. We held a hearing 3 months later in our subcommittee, got it out of the full committee, got it past the Senate, sent it over to the House. They passed it. If anybody has been in the President's room off the Senate floor, it's a very grand room, and everybody kind of piles in, and you grab senators from off the floor in between votes. There's a lot of activity, and a lot of work goes into a markup that could last 10 minutes, and if it goes smoothly and nothing happens, you've done your job, and from there you walk out of the President's room and it moves on to the next stage. So that was a great moment.